Good evening, everyone, and welcome. Welcome. Dr. Madad, it's wonderful to see you. Thank you so much for joining us. And thanks to all of you in the community who have logged on tonight for this conversation. We have been doing these for a year and 3/4 now, discussions about this pandemic and the challenges facing our city. And I'm sure you join me when I say that I wish we didn't have to continue with these conversations, but alas, COVID had other plans for us. And so tonight we're gonna take a real honest and sober look at what's ahead for the pandemic in New York City as relates to the Delta wave, which is coming on strong, and as relates to the unknown threat of Omicron, which is here circulating in our city as well. And we could not have a better guest for tonight's discussion. Dr. Syra Madad is a nationally recognized epidemiologist. Some of you might know her from what was probably her breakout moment as one of the featured scientists in a Netflix series called Pandemic: How to Stop an Outbreak that hit coincidentally in early 2020, just before COVID. Some of you might know her from her frequent media appearances, always being a voice of reason on the pandemic, but she actually plays a very prominent role in New York City as the Senior Director for Special Pathogens in our public hospital system, in our health and hospital system. So that's everything from preparing for an outbreak of Ebola to managing protocols to keep staff safe in the midst of the COVID pandemic. And she has got something of a specialty in biosecurity. And it is good to remember that COVID and public health generally needs to be understood as a security issue. It's about keeping us safe. Just like the fire department has to keep us safe, our public health institutions keep us safe. And she's a leading voice from that perspective. So I am just thrilled that she has joined us. And I'm gonna give her a chance to introduce herself in a moment. And she's got a little bit of a PowerPoint for us as well, which I can't wait to see. But I want to remind all of you that we welcome your questions, and you can post them in the chat, and we'll get to as many as we can. Dr. Madad, we always use this somewhat bilingually. Ustedes saben que siempre pueden hacer sus preguntas en inglés o español, el idioma que ustedes deseen, y trataremos de contestar también en su idioma. And now I'm going to, without further ado, welcome you, Dr. Madad. Thank you so much for joining us. And I know that you have a short presentation on some of the facts and figures and the science, but could you start by just with a little more of a personal statement about how it is that you wound up in this prominent position as the Senior Director of Special Pathogens at Health and Hospitals and a leading voice on this pandemic? Welcome, and look forward to hearing from you.
First, thank you so much for this opportunity, Councilmember Mark Levin. Really great to be here with you all and to help kind of put some science and data into what we're dealing with in this current pandemic and talk all about the new variant. But before we do that, I certainly have the privilege of serving at New York City Health and Hospitals in the roles that I'm currently in as the Senior Director of the System-Wide Special Pathogens Program. And before COVID, no one even probably even knew what the term special pathogens meant. And now everybody is a pro at what an infectious disease is, how viruses spread, and how we can protect ourselves, because we've been 2 years into this now. And we've learned a lot about this virus, and we've also learned a lot about generally how respiratory viruses behave. My interest in this field, ironically, actually started when I was a young girl and I watched a Hollywood film called Outbreak. And in that movie, if those of you that have seen it, may remember there are individuals that are wearing these yellow bubble suits, and they're going out in the community and they're figuring out what is causing this mass amount of morbidity and mortality. They're in the hospital environment caring for patients, and that was kind of my entree. That was kind of my first, experience of, oh my goodness, first of all, infectious disease exists, and not only are they so powerful, they're able to bring humanities to to our knees, and we need to make sure that we're able to have a plan in place, and we have resources and the technology and the pharmaceutical and non-pharmaceutical components along with it. And so that's kind of how my interest started. And ever since then, I've had multiple different opportunities that have been given to me, pursued, my various career in infectious disease, got my doctorate in global health, and did a lot of work in Texas as part of the Ebola response team there, working with biothreats. So biothreats are, for example, select agents, hot agents, as we call it. And so it's always been a passion of mine. And now with COVID-19, all of us have been front and center, even though we've been working on these different infectious diseases for years, and we've been trying to sound the alarm that we need to make sure we're better prepared for these types of threats, because we know that in the world we have all these ingredients, for a pandemic, and it's just waiting to happen, and we need to be proactive about it. And unfortunately, now here we are 2 years in, and we've learned a lot. And I think we've done a lot, and we are certainly building back better, both here in New York City as well as around the nation. But there's a lot more that we can do. And I think if there's one thing that we can say is a wild card, besides variants, it is our behavior, right? And each one of us has, an impact on this pandemic and the choices that we make through vaccination, through wearing a mask, and through obviously, acting safely in that sense. And so that's some of the things that I hope to highlight, is not only the current threat that we're dealing with, but what can we do individually and then collectively to help end this pandemic for all of us.
Dustin Hoffman must be very proud knowing he inspired a future scientist like you.
That's right.
And it is wonderful to hear your story. And I'm excited to get into some of the science that you're willing to share with us. So Winthrop on my team, I don't know if you can enable Dr. Madad to do screen sharing. And there we go.
All right. Well, I'm going to go ahead and take it away. So
Please.
The first thing I want to, start off with, and this is a really great slide from Yale University, and what it basically is showing is that we're not back at square one. Obviously, there's a lot of panic and anxiety with this new Omicron variant, and what it means to us locally here in New York City, what it means to the trajectory of this pandemic here in New York, as well as around the nation, as well as around the world. But I think it's really important to first stress is that we are 2 years into this pandemic. We have learned a lot, as I've mentioned. We have the tools to be able to mitigate and contain the threat to a certain extent, but we also know how to keep each one of us safe, both at the individual level and at the community level. In addition to that, if we look back at 2020, we didn't have, these safe and effective COVID-19 vaccines with amazing safety profiles. We didn't have really great supply of masks, and now you can buy an N95 mask, at the local pharmacy and be able to better protect yourself. We also have much better testing capability. You're seeing the current administration really invest in at-home testing, and that's really going to increase by 2 to 3-fold in the next coming weeks to months. And so we're able to have access to testing at our fingertips and be able to do it at the convenience, of our home. So there's so much that we have now that we didn't have back in 2020. And as we look at the current variant, that is, all over the news and certainly is very concerning, I think it's also really important to highlight some of the things that are working in our favor. And one thing that's working in our favor is that we were able to detect this variant very early on. And as you can see, from the time from variant identification to classification of a variant of concern, Delta took 6 months, right? And with the Omicron variant, it took 2 days. And that's really thanks to our South African colleagues in public health and healthcare that have been working around the clock to really sound the alarm and provide us really great early information. So we're able to track it better, or we're able to monitor it better. And now here in the United States, we have a much better surveillance system and monitoring system, both locally here in New York City, which really has been one of the leaders in the nation, as well as across the nation. So we are having a better head start, if you will. So, I think a couple of things to also start off on as we talk about this current, the Omicron variant and what it means. On November 26th, the World Health Organization classified this as a variant of concern, given reports of, higher transmissibility. We'll get into what that means in a moment. And then the United States classified, Omicron as a variant of concern November 30th. If you can just go back to the previous slide, sorry, I'm going to get to that in a moment. So I think the one thing that I just want to emphasize here is obviously it is a variant of concern. We'll get into what it means in terms of transmission, severity and illness, as well as what it also means to our immunity. But the one thing that I do want to highlight very early on and upfront is that even though the recent emergence of this Omicron variant, is something that we should be concerned about and we should continue to keep an eye on, it just emphasizes the importance of vaccination, being able to get a booster if you're eligible. And again, I'll highlight the importance of that in a moment. And then additional general prevention strategies like wearing a mask and things like that to protect yourself and others. We have these tools and we know that we can protect us and everyone in our community. Next slide, please. So before we kind of get into what we know and what we don't know, I want to level set to show where we are here locally in New York. So as you know, cases are starting to increase and they have been increasing slightly. So close to about 2,000 new cases, that we're seeing per day here in New York City. We know we are seeing about 109 new hospitalizations, and so that is starting to tick up a little bit. And so certainly our various indicators are increasing slightly, and at the national level, it's even worse. So if you are monitoring what's happening nationally, you're seeing our 70 average hit over 100,000 new infections. We're seeing, thousands of new hospitalizations per day. So it's a steady and slow rise in terms of hospitalization and as well as with deaths. And so this is predominantly the Delta variant. And I think that's really important to emphasize. So while you're hearing about the Omicron variant and, how many cases have been detected, around the world, and just to mention, it's been detected in 44 countries, and here in the US, about 17 states have detected Omicron variant. Delta still is the most predominant strand. About 99% of all of our cases are still Delta. And so while, we are monitoring what's happening with Omicron, we are still very much concerned about Delta, and the new infections that are going to continue to happen are predominantly going to be Delta. So we need to continue to emphasize the same message that we have for Delta that we have for this Omicron variant. And so to stop any variant, really, we need to focus on reducing local transmission levels. And we'll get into how we can help reduce transmission levels in a moment. Next slide, please. What I want to also show is, what it means to be vaccinated versus what it means to be unvaccinated. And in the first graph here, you're seeing number of cases, right? And we'll get into hospitalizations and death in a moment. But as we talk about cases, you're seeing that by and large, you're seeing a larger number of increase in terms of new cases in those that are unvaccinated versus those that are vaccinated. When there's higher amounts of the virus in our communities, there's going to be more likelihood, for example, of those that are fully vaccinated to experience a breakthrough infection. And that's going to be common because, again, you're going to have much more virus in the community, so your exposure is going to be higher. But those that are unvaccinated have a much higher risk of getting infected. In fact, CDC data shows that you have at least a 5 to 8 time fold increase of actually getting infected with COVID-19 versus if you are fully vaccinated. So really important to emphasize what we're seeing in terms of cases and new cases and who is actually getting infected. Next slide, please. As we look at hospitalization, so who is in our hospitals right now? And similarly, if you're following the purple line and the orange line, you're seeing that majority of the individuals that are currently hospitalized are the unvaccinated, and those that are vaccinated are still very well protected against the most severe outcomes. And those that are hospitalized, by and large, you're seeing additional comorbidities. You're seeing that they may have not gotten their booster dose because of waning immunity, and you're seeing more of these types of cases. But you're seeing those that are hospitalized are still unvaccinated. So going back to some CDC data, those that are unvaccinated have a 10-time increase in being hospitalized versus those that are vaccinated. Next slide, please. And then similarly with deaths, you're seeing, again, those that are unvaccinated have a higher proportion of dying versus those that are unvaccinated. And again, going back to CDC data, you're seeing that those that are unvaccinated have a 10-time or tenfold increase of dying versus those that are vaccinated. So really important to put, the benefits of vaccination and what we're actually seeing play out in the real world, who is being infected, who is being hospitalized, and who is dying by and large from COVID-19. Next slide, please. So now let's get into the new Omicron variant and what this means. So what do we know and what do we don't know yet? So what we know so far is that, as I mentioned, this new variant has been identified in over 44 countries so far in 17 states here in the United States. There are about 50 mutations in this new variant, which is concerning. About 30 of them are on the spike protein. It's not just about the number of mutations that's concerning, it's the quality of mutations and where these mutations are. That is a bit of a concern. And the reason for that is because some of these variants, some of these mutations that we have seen in previous variants of concern, like beta and lambda and alpha, they have been associated with more transmissibility or decreased immunity from our vaccines or from prior infection. And so when you're seeing that in top of new mutations, we're not exactly sure what those mean. And that's where when we're saying we don't know yet in terms of severity of illness and if it's more transmissible, and I'll give you some more data based on what we know so far, it's hard to tell because it takes time for good science. It takes time to collect this information. It's not enough to just study this in the lab setting, which is a controlled environment. So you may get information that may not actually play out well in the real world. So when you marry up what's in the lab and what's happening in the lab as you're growing this virus and you're, seeing, for those that are fully vaccinated, what is the impact? Those that have prior immunity or prior infection, what is the impact? And things like that. You need to couple that with what's also happening in the real world, because that's where things can be very different, as well as looking at the clinical picture. And that certainly does take time. So right now, what are we still looking at and what do we still need to find more information on? First is transmissibility. If we're looking at the early information that we have, it does seem that it is much more transmissible than the Delta variant. The big question is, can it outcompete the Delta variant? I think that's certainly still something up in the air. So right now we know Delta obviously is a dominant variant here in the United States as well as around the world. Can it outcompete Delta in countries that are predominantly Delta? That is something to be seen. But certainly as we're looking at, is it more contagious? We are seeing a significant surge of cases in South Africa, where it appears to be much more transmissible. And we're also seeing in terms of some of the new reports coming out, for example, one traveler that, had flown from Hong Kong. If you're looking at the viral load, and that particular small sample size, the viral load was very high, which shows that it could be much more transmissible. If you're looking at the flight from Netherlands, you're seeing the prevalence of those that were infected on the flight was pretty high. And so these are some early indications that are showing us that it may be much more transmissible than Delta. But again, we're still waiting on better information, better sample size, and also a better peer-reviewed data to show that, yes, this is indeed more transmissible. Now, the question, is it more virulent? What does that mean? It means that can it cause more severe illness or more severe disease than Delta? There are some anecdotal reports. There are some reports that recently actually have come out this past weekend from South Africa, from some of the hospitals there. And what they're showing is, right now, again, very small sample size, very early on, it seems to not be as virulent as the Delta variant, but there's a couple of caveats there. And some of the caveats is that when you're looking at some of these reports, there's been a lot of infection in South Africa from the Delta variant. And so some of the individuals that are being hospitalized, are very young. And so we know that when you're young, you tend to have a better clinical course. And so the information is a bit skewed if we play that out here in the United States. Second, because there was so much infection in South Africa, because of the prior immunity, if they got reinfected, they may, be suffering from less severe illness. So we don't know what this will mean for the unvaccinated, people that are unvaccinated and people that have not been infected previously or have that previous, natural immunity. And so there is a question there. Is it truly less severe because there was a lot of prior immunity in that population and now they're getting infected with this new variant, and that's what's causing less severity. We don't know, and that's where we need to wait for better information, and that's going to come out hopefully in the next few weeks, and we have a better pulse on what that actually means. So I will say take that with a grain of salt. Certainly it's good news, but I will take that with a grain of salt. The third is, what is the impact to our current immunity from vaccines, as well as if we were infected previously? So first, it doesn't bode well for those that were naturally infected or previously infected and have not been vaccinated. So there is some much better reporting now that we can say more reliably that individuals, for example, in South Africa that had prior infection still have a 2 to 3 time risk of reinfection with this new variant. So even if they've been infected with Delta, there's a 2 to 3 time risk or 2 to 3-fold increased risk of reinfection with the Omicron variant. So what is the message here? It just reemphasizes the need for vaccination, because vaccination provides much more durable and predictable immunity. Now, what does this mean for those that have been fully vaccinated? And what does it mean to our immunity? First, our immune response, our immune systems are so complex. They have multiple different layers if you peel it back. And so my my scientific opinion, the opinion of many of my colleagues that are in these vaccine circles, that are in the public health circle, is that our vaccines will continue to hold up, both from Delta, as we've seen, as well as with the Omicron variant. It may take it down a couple of notches in terms of vaccine effectiveness against infection, meaning you may get infected, but it's still going to hold very well in terms of severe illness, hospitalization, and death. But again, we're going to still wait on some more data to show that. And that's where boosters provide even better protection, because they not only strengthen our current protection against this virus, but it also provides more broad protection. And that's why there's been a more significant push, as well as CDC updating their language and strengthening that now everybody over the age of 18 should get a booster shot if they're eligible. So if you've got the mRNA-based COVID-19 vaccines, and it's 6 months after that, or the Johnson & Johnson 2 months after that. So certainly if you're eligible, get that booster dose. Next slide, please. So what can we do right now? So as we're waiting on more information about this new variant, as we're learning more, as we're hearing more reports come through, certainly it is concerning. People obviously are having anxiety. All of us are having anxiety, but I think it's also calming to know that we have the tools to combat any variant, whether it's Delta or Omicron or any other variant that's going to come after that. We have the tools. And so the first thing that I want to mention is that risk reduction is additive. And what I mean by that is that when you add more layers of protection, it helps, similar to that Swiss cheese strategy approach that is brilliant. It's showing you that when you layer on these different risk reduction measures, it helps to reduce your total risk. So what's some of the best ways to reduce your risk, and what can we do right now collectively? First, it is to get vaccinated. That's really, really important, because again, as I've shown you, those that are relying on previous infection, there is a 2 to 3 time increased risk of getting reinfected. So vaccination is still our best strategy. And then if you're eligible, as I mentioned, getting your booster dose, because it strengthens and broadens your immune response to the virus. The third is continue wearing a mask in indoor settings. Really important, because we want to couple, even though you're vaccinated, we want to continue to mask in these indoor mixed gatherings, as well as, I would say, if you're outdoors and in very crowded situations where you're shoulder to shoulder somebody, it's always a good idea to wear a mask in that instance as well. So wanting to couple wearing a high quality mask. And again, as I mentioned, supply chain is much more better now. So you're able to get, higher quality mask, like a KN95 or an N95 and the like. Another risk reduction strategy is to get tested. So certainly if you're symptomatic, you should get tested. And if you think you've been exposed to somebody, you should get tested, as well as getting tested routinely. So if you're going to gather for, a girls' night out, or for a meal with family, or going to a party or wedding, it's always best to get tested ahead of time. I like to do serial testing. So I like to get tested 2 to 3 days before the event, and then the day of the event. So I know that truly I'm not actively infected. But if you, have only an option to do one, I would say certainly the day of the event. So get routinely tested just to ensure that you are not actively infected with the virus. You may not feel sick, but if you are infected, you want to make sure you don't spread it to others. And then if you have a positive result, you should isolate. I think, we're 2 years into this pandemic. No one should have to tell you that if you're positive, you should stay home. You should not, mingle with even your own household members. Certainly seek healthcare services. quarantine if you are waiting for that test result, and we have resources to help you. So here at New York City Health and Hospitals, which has been one of the leaders here in the United States in providing these wraparound services, there's isolation and quarantine hotels that you can safely separate from loved ones to make sure you're not spreading it to them. There's also wraparound services so you can stay home, and in the convenience of your home, you can have resources sent to you. So there's a lot that you can do and ask for that can provide you with that with those services. And another measure is practicing respiratory etiquette. We, in addition to COVID, flu season is also upon us. You may have seen the New York State flu surveillance report that flu is considered widespread in the state of New York. Locally here in New York City, we still are having very low levels of flu, but regardless of what virus we're talking about, whether it's COVID or flu or any other respiratory virus, always practice good respiratory etiquette, meaning if you're coughing and you don't have a mask on, use your elbow, use your tissue, wash your hands often. These are all just good respiratory etiquette techniques that we should continue to do regardless of the respiratory disease that we're dealing with. Another is weighing in on the relative risk of activities. So if you're going to go to a very crowded indoor activity, weighing your risk, do you want to do it indoors versus outdoors? Luckily here in New York City, we have much better public health policies where, individuals, for example, are in restaurants are fully vaccinated, for example. That gives you that really great level of assurance. So it makes you much more comfortable. But, seeing if you're also traveling, what this means and where you're going, and obviously looking at your own relative risk. Another is monitoring your health, right? And so while you may be fully vaccinated and you got your booster dose, it's always good to continue to monitor your health to see, how you're feeling and how you're doing. And if you have, any type of symptoms or you're feeling a bit under the weather, first, you shouldn't be, mingling with others and then get tested, because sometimes you don't know whether it's COVID or if it's the flu, if flu is circulating. So getting tested is the best way to see whether you have COVID or the flu. And then certainly seeking, your healthcare provider if you have any questions. And then lastly, picking up the phone if you've been contacted by a contact tracer. Really important, because as you know, our public health colleagues and those that are in test and trace are working around the clock to really make sure the city continues to be is the safest as possible, and trying to squash any clusters from becoming outbreaks, and outbreaks from becoming much more widespread. And that's because of you all who are able to provide information to public health colleagues and prevent more widespread transmission of this virus. And so what I want to leave you with from the slide is ultimately we want to lower your risk of contracting the virus, regardless of the variant that we're talking about. We want to lower your risk, and so by doing all these things, you're able to reduce your risk. And so by applying these risk reduction measures, you're in a much better, a much better place. Next slide, please. So another really important risk reduction measure that I would put up there is staying informed, right? So knowing, where you're going, and knowing what's happening around you. So staying up to date on local COVID-19 news is really, really important, and going to credible sources of information. There is a lot of bad information out there. And so some of my go-to sources of information that I would recommend first, is looking at the local level. So where you live, you want to know what's happening in your zip code, what's happening in your neighborhood, what's happening at the community level. And the best place to go is your local health department. And City Department of Health does an amazing job providing up-to-date information. You can also go to New York City Health and Hospitals. They provide really great information as well. CDC is another really great, credible resource. And then trusted messengers in your community, like Council Member Mark Levine is a trusted member in our community. In fact, I also looked at his Twitter to get some up-to-date information on what's happening locally here in the New York City area. So go to your trusted sources of information that are providing you with true information to keep you and your loved ones safe. Next slide, please. And before I conclude and take questions, I want to make sure I leave you with a tactic of how to evaluate credible sources of information, because there is so much mis and disinformation out there. It's a huge, huge problem. Not only is it a problem because it is basically extending our pandemic, because there's so much bad information. People are putting themselves at higher risk and, not getting vaccinated because they don't have the right scientific information. It's also obviously putting everybody at risk, because we have less number of people that obviously are following these important measures to reduce risk for themselves and for everybody. So how can you evaluate credible sources? So there's a lot of information out there, depending on where you go to, whether it's social media, whether it's the news. Here is my 5W approach that I've published on that helps you evaluate is this good factual information that I should share and believe in? So the first is, whose website it is. So if you're going to a website, whose website are you going to? Is it a government website? Is it a specific companies or individuals? And do they have a track record of sharing credible information? So who's, who you're going to? That's one W. What is the source offering? So are they offering a recommendation? Are they selling a product? Are they making a claim? This kind of tells you if they're selling a product, they want to sell their product. So you want to obviously make sure that you're getting good information and evaluating that. A third W is, when was the information written? As you know, this pandemic is going lightning speed. We are learning more information every day. Things are constantly changing. So when was this information written? And as you can see, CDC has also evolved their guidance, as well as New York City. As we learn more information, it's not that science has lied to you. It's because science changed because we learn more information. And so we want to make sure, when was this last updated and by whom? Another W is, why does this source exist? Does it exist because they want to give you information? Is it because they're selling you something? Is it because they're here because they're a public entity or a public health institution? Why do they exist, right? What's their purpose? And then the last W is, where is this information coming from? Is it actually based on scientific literature, or are they just talking based on their own personal experience, right? Everybody has an opinion, but no one has the right to their own facts in that sense, right? We want to go with the science and the data. So really important to evaluate your sources of information through this type of approach, and going to credible sources of information that can help inform you in your day-to-day decision making. Next slide, please. And with that, I am happy to take any questions. I'm going to hand it over to Councilmember Mark.
Wow, my goodness, that was an incredible presentation, chock full of useful information. If it's okay, we're gonna pass on the PowerPoint to folks here who were asking to get a copy of it because it was so helpful.
Absolutely.
And there's been many great questions and comments in the chat already. A number are around the question of masking and comments about masking, and I'll just echo the sentiments of a number of you. It is unacceptable if public sector workers, such as police officers, are not masking. That's true anywhere, but especially in a setting like a subway station. And really, there has to be accountability for that, especially in an institution like the NYPD, which is supposed to be a command and control structure. So we're continuing to fight with all of you to ensure compliance with masking by all public sector workers. But as to the question, Dr. Madad, for why it is that someone who's fully vaccinated needs to wear a mask, could you speak to the relative risk that they might face in contracting or spreading the virus?
So first, if you're fully vaccinated, you are well protected against the most severe outcomes. Now, what we know about these COVID-19 vaccines, as remarkable and amazing they are, and as well as safe they are, they're not 100%. They don't provide you that 100% protection against infection. And what this means is that when there's a lot of virus circulating in your community, the chances of you interacting with somebody that has COVID-19 or you being exposed to the virus that causes COVID-19 increases. And so what this may mean for you as a fully vaccinated individual is that you may experience a breakthrough infection. Now, there's a full spectrum of what a breakthrough infection may mean. You may become asymptomatic, so you may not even feel that you were infected and you have no symptoms. You may have mild symptoms like a fever and a cough, or it might be moderate, or it may even be more severe. And on the severe spectrum, it may also be because you're maybe immunocompromised, you didn't generate a robust immune response. You may have not gotten that booster dose for 6 months out, for example, from an mRNA-based one, so you have less of a protection against infection in that sense. But in addition to obviously suffering from potential symptoms and the potential for long COVID. So if you're fully vaccinated, the benefit also of being vaccinated is that your chances of having long COVID, which is more of a chronic condition, is reduced by half, but it's still there, right? So it helps protect you against that. But then in addition, you can also transmit the virus to other people, right? And so even if you're fully vaccinated, if you get exposed and you're infected with the virus, in the initial days, you still have enough virus in your body to be able to actually spread it to others. And that's why masking helps prevent the ongoing spread to other people. So it's protecting those around you. And that's why it's really important that you wear a mask, especially if you're in areas with high or substantial community transmission. And I can tell you in the United States, about over 85 to 90% of counties actually fall into that high to significant amount of community transmission.
You were very clear in your presentation about what we know and don't know about Omicron. How soon will we have answers to questions like whether it overcomes immunity and whether it's more severe or more mild?
Well, based on the three key questions, and really there's four key questions. The fourth I didn't cover is, does it have an impact for diagnostics and therapeutics? And luckily it doesn't have an impact, so I didn't really cover it in that sense. But in terms of transmissibility, when will we know if this is a much more transmissible variant than Delta? I think that information is really going to come out in the next few days to weeks. That's probably going to be the soonest piece of question that will probably get answered. And we're already seeing some really good data come out that is showing that it is by and large more transmissible than Delta. But again, we need to have much more factual and a larger sample size to show that. In terms of, is it going to cause more severe illness and death? The reason why that's going to take a little bit longer, I would say another 2 to 4 weeks, is because when you look at from the time an individual gets infected with the virus to the time they may require hospitalization, it can take 3 to 4 weeks. And so if this new variant truly is new in the sense that it just started, then it's going to take us time to actually assess, is it actually causing more severe illness and death? And as I mentioned early on, there's a lot of anecdotal reports, a lot of smaller sample size. We need much better concrete data to show that this is something that's going to be less virulent than Delta. So that's going to take a little bit more time. So hospitalizations and deaths is probably going to take us a little bit more to assess. And then in terms of, is it going to impact our immunity? I don't like the term vaccine escape or the like, because what it's telling you is that these variants have the ability to escape our immunity, when it's actually telling you that it may reduce our immunity by a couple of notches. So it's going to chip it away a little bit. Now, how much is it going to chip it away? As you know, Delta chipped away at our vaccine-induced immunity just by a little bit. I'm assuming Omicron is going to do the same, but it's still going to hold pretty intact for severe illness and hospitalization. I think that information is probably going to come out in the next 2 to 4 weeks, because everybody's kind of working on that in the vaccine circles. So we'll get some more information on that quite soon.
We have a question from Josh Karen, and one that I hear often about people who have recovered from COVID and so have some naturally acquired immunity, and whether or not they should get vaccinated, and perhaps also if you could weigh in on if there's any hints yet on whether Omicron will change that equation.
Yeah, so right now, I'll take the last question first. So in terms of, does the Omicron variant impact those that have had previous infections? So if you were previously infected with Delta or Alpha, whether you were just previously infected generally, what does that mean to you? If that's what you're banking on in terms of, okay, I have some immunity, what you're seeing in some of these new reports that are much more credible is that the risk of reinfection is actually 2 to 3-fold increased. And so what this means is that you have a much higher likelihood of getting reinfected with this new variant if all you have is just previous infection-induced immunity. And that's where vaccination provides much more durable and much more predictable immunity. So really important, in that sense. What was the first part of the question?
Well, I think you addressed it. Just
okay.
Generally, whether someone who has recovered needs to get the vaccine or not, or whether they're adequately immunized naturally from recovering. But I think you said pretty firmly that while you do get a benefit having recovered, you get much more benefit if on top of that you get your vaccine.
I think the one thing that I will just quickly add is that when you have vaccine-induced immunity, you have the option to get a booster dose like we do now, and that's going to increase and strengthen our immune response. So with this new variant, we're learning that it's important that you get your booster dose because it gives you that strengthened and more broader immune response. If you have previous infection, in order for you to have a better immune response, you're going to have to get reinfected. And what does that mean? Reinfected means you're going to have to suffer through acute illness, you're going to take a gamble of hospitalization and death. So you can't redose natural infection, right? You can redose with vaccines, but you can't redose with natural infection. And that's where it's another kind of important to highlight why it's important to get vaccinated in that sense.
Yes, we had a question from Lynn Max about boosters. Given that immunity seems to wane, should we prepare for the possibility of a second booster or a fourth shot at some point?
Well, I think right now it's too early to tell, but what we do talk about in our vaccine circles is that third dose, right? So there's a question of should it be considered a booster dose or should it just be part of a 3-part vaccine, regimen? And obviously there's a lot of discussion on there, but the third dose is really what's going to provide what we believe much long-term immunity. Again, we need data to back that up, but once your immune system gets that first dose, is primed again with that second dose, it's that third dose that really kind of provides you with that more long-term protection. Now, is it going to be required that we're going to get another booster shot annually? I think that's another question that we're going to continue to investigate through better data and better science.
There's a question that I can quickly answer about the New Year's Eve celebration in Times Square. It is on. It's going to be fully screened for vaccination and masks are going to be required. But if for some reason you want to stand outside in the cold and celebrate the new year, you're going to be able to do it in person this year. We have many questions about testing, and one that I'll just acknowledge up front from Kim Mascatarolo is about the difficulty in getting access to rapid home tests. It's much more difficult in New York City, in America, than in other parts of the world where it's free or nearly free and much more widely accessible. And here in New York, you have to scramble going from one pharmacy to another to find one, and then you're going to pay $24 for a kit of 2. Personally, I am strongly advocating for the city or the state or even potentially the federal government to use its purchasing power to acquire these in bulk and then distribute them for free or nearly free out of libraries or firehouses or schools, et cetera. By the way, I'd like to see that done for high quality masks as well, KF94 and 95, et cetera. The city could buy them in bulk for much cheaper and give them out to people so we can up our mask game a little bit. But could you comment, Dr. Madad, on the accuracy of these rapid home tests, about whether there's any reason to doubt that they'll be good at measuring the new variant, and about a little more about sort of when people should think about getting tested, including if they're already vaccinated?
Yeah, great question. So do our current diagnostic tests like PCR and at-home antigen tests work? They still work against the Delta variant as well as the Omicron variant because they detect a different part of the virus, so the nucleocapsid. So that hasn't changed. So bottom line is they still work against all the variants in that sense. Now, the accuracy of these tests obviously is based on what type of test that you're using and the manufacturer. But generally speaking, I use at-home tests all the time as well. So if I am having individuals come to my home, or if I'm going to a gathering, then I use these at-home tests. It's really great. It's convenient. It's easy. But certainly, I think the expense is a barrier, and the current Biden administration is having a much heavier push to have more free at-home tests. So I think you're going to have a much more supply that's going to be free, that's going to be flooding the market. I would say in the next couple of weeks, that is something that they're actively working on. And so at that point, I think it could have happened sooner. I completely agree, but I'm glad at least it's happening now. So I definitely encourage those that want to do at-home testing with these antigen tests to do so. Now, when is the best time to do at-home testing? So first, as I mentioned, if you're symptomatic, definitely get tested. Now, whether you want to do a PCR test or an at-home test, that's really up to you, but it also depends on If you're traveling, some of the institutions may require a PCR test. You have to get a PCR. Or if you're going, to a school or whatnot, some of them may have certain requirements depending on obviously what you're testing for. So if you're symptomatic, certainly get tested. If you've been exposed, again, that's another really great reason to get tested. And the third is to test routinely. And routinely meaning if you're going to gather with individuals that may not be vaccinated or are vaccinated, regardless of the vaccination status, to make that gathering safer. It's a great way to ensure that there's no virus coming into that gathering. You want to go ahead and get tested. Now, as I mentioned, like to do 2 tests because it kind of gives you a much better accuracy. So if the first one, for example, the result is faulty, at least you have a second result. So you have a better chance of it being a true negative or positive. So I like to do it about 2 to 3 days before, a gathering and then the day of. But as I mentioned, if you only have one option, I would do it the day of. So I definitely encourage these at-home tests. And in fact, actually this morning, I was informed the CDC just updated their website to provide additional public health guidance for those that are testing at home and what to look out for and what to do. So I can share that with your group, Councilmember Mark, and if you want to share that with those participants, yep, you can do so.
That would be great. We've had a number of questions about antibody tests. And these were all the rage when they first became accessible. At this point, I think we're talking like basically the summer of 2020. But some people are using them now, I think, to determine whether they need to get a vaccine or not. Could you comment on whether and when getting an antibody test is useful and when it actually could give you unhelpful information potentially?
Yeah, so if you're getting an antibody test, first, obviously, the reason matters. It can give you a false sense of security if you're testing your antibodies to see if you need a vaccination. And there's a couple of reasons for that. First, the serology testing or the antibody testing is not made to evaluate whether you have antibodies that's going to provide you long-term protection against the virus. It's just telling you that you have antibodies in this moment. But as we've seen with studies and multiple studies now, this is not just one, but very large studies, that a lot of people don't seroconvert. And what that means is that you may have an initial antibody response, but then you don't convert that into long-term immunity or a long-term immune response. And there's about 10 to 19% of individuals that fall into that category. And you have no idea whether you fall into that category or not. So again, you're taking that risk. The second part is whether you should get vaccinated or not. They're made to see if you had COVID-19 before. So maybe you are coming in 2 to 3 weeks later and you're having symptoms and they want to see, well, maybe you have long COVID or you have MSC. So these are some clinical considerations that we would use, for example, in the healthcare setting to see if you had previous infection and if this is being attributed to your current symptoms. And so really important to see what the purpose is, but really do not use it in terms of, proving that you don't need to get a vaccine because you don't know whether, you're one of those individuals that doesn't seroconvert.
Yes, we had a specific question about deciding whether to get a booster based on your results from an antibody test, but you're given a pretty strong response that that's not really a good use of that test. Is that an accurate?
That's an accurate, yes.
Accurate summation. Wonderful. Okay, we have a question on long haul. This is still not getting enough attention, but the estimates are that potentially millions of Americans are suffering with long haul symptoms. Do we know any more about this condition? Do we know any more about whether vaccination alleviates it? And do we have any sense that people with long haul are any more or less vulnerable to emerging variants, or is that not even really a relevant question?
Well, I think first, one of the benefits of getting vaccinated against COVID-19 is that it reduces your risk of contracting COVID-19 in the first place, as I mentioned. And I actually made a little grid, 16 reasons why you should get vaccinated. And I'll share this with the group if you want to share with your audience. And in those 16 reasons of why you should get vaccinated, the first is that it reduces your risk of even contracting the virus by 5 times, right, compared to an unvaccinated person. The second is that it also reduces your risk of experiencing long COVID. So if you have a breakthrough infection, so you're fully vaccinated, and unfortunately you have a breakthrough infection, your risk of actually experiencing long COVID is reduced by nearly half. Now, that's still obviously, no one wants to experience any type of illness, any type of condition, but obviously at least it's giving you that really great reduction of by 50%. Now, we certainly don't have as much information as we would like about long COVID. This is a new phenomena that recently has been known over the past a year and a half, I would say. There's a lot of work that's actively being done at all levels of government, from an international to a federal to a local and state perspective. You're seeing about 50% of those individuals that have been infected actually experience at least one or two ongoing symptoms of COVID. So they experience this long COVID in their own form or fashion. You're also seeing that it can put you at increased risk for other types of cardiovascular diseases, other vascular diseases in general, lung conditions, things like that. So really important not to underestimate this virus, because people often just look at what is the virus cause? It's just going to make me sick for maybe a week or so, and that's it. But they oftentimes don't, factor in that there is that long COVID that you can experience. And we are learning much more about it. And luckily here in New York City and in the healthcare system that I work for, there are these COVID centers of excellence, and they recognize that this is a problem in the community, and they're providing resources for those individuals. So if you experience long COVID, if you think you have long COVID, certainly go to these centers or speak to your healthcare provider, because there are resources at your disposal that can benefit you.
What are the COVID centers of excellence that you can refer people to if they're suffering from long haul?
Yeah, so they're part of New York City.
Designated like three of the H&H hospitals, I think.
That's right. They're like the Gotham Health outpatient centers, and I can send you a link to those if anybody wants to learn more. They can certainly do so. Great.
Several people have asked about holiday plans, and some people made holiday plans a couple months ago before we knew we'd be facing a new variant. And what's your advice to folks about how to think about continuing with those plans, modifying them, even canceling them if need be?
Well, first, it's obviously a personal decision. And so at the personal level, if you're somebody that is at higher risk of experiencing severe illness, or you're immunocompromised, then you want to evaluate and see, well, how can I make a gathering safer if I were to go? Now, individuals that are generally fully vaccinated, I think we can make gatherings safer. I certainly still plan on getting togethers for the holiday with my family, and we now have the tools to make any type of gathering safer. So not only obviously vaccination and having that booster dose, but also ventilation is really, really important. And it can be as simple as opening a window or a door, or having activities outdoors, getting tested before the event. I think if we implement all of these different layers, as I've mentioned, layering it up, we can help keep that virus out of our gatherings and have a safer environment. So we now have the tools to do that. It just depends on your own personal risk tolerance now.
COVID in kids. New York City is behind on vaccinating children in the 5 to 11 age group. We've only got about 20% of kids covered. And actually, we're seeing now the highest incidence of COVID amongst that age group because they're not vaccinated primarily. Can you say anything about the risk that children face, whether we know about Omicron changing that, and the safety and importance of vaccination for that age group?
Yeah, absolutely. So first, I'm also a mother. I'm a mother of 3. I have 3 children, 1.5, a 6-year-old, and an 8-year-old. And my 6 and 8-year-old received their first dose of the COVID-19 vaccine. They're actually due for their second dose in the next 2 days. And so I feel really great that they are going to be fully protected against this virus, because I know that they are not immune to suffering from illness and even the long COVID that we just talked about. And so I don't want to put them into this position, because I know this is now a preventable illness. It's a preventable disease. And so I'm going to make that decision to vaccinate my children. And then when a vaccine is available for my younger child, once I look at the safety profile, I'll feel confident of vaccinating her as well. The one thing that I'll first start off with is that 7 million children have tested positive for COVID-19 since the onset of this pandemic. And for the 17th week in a row here in the United States, we've had over 100,000 new cases being added. So that's an astronomical high number of cases in the pediatric population that is getting infected every single week. And obviously you're seeing children do end up in the hospital. You do see children unfortunately dying from this disease and also suffering from long COVID. I actually know personally some children that suffer from long COVID, and it has an impact on their daily life. They can't participate in extracurricular activities. They have a hard time concentrating in school. So that's becoming, unfortunately, more common in the circles that I'm in. So it's really important to get your child vaccinated if they're eligible. If you have any questions, certainly speak to your pediatrician. You can also go to the City Department of Health's website or Health and Hospitals website that provides really great information on the importance of vaccination in this age group. Vaccines are safe, and I do agree we are behind the 8 ball in getting our children vaccinated. And I will tell you, you don't want to wait until this new Omicron variant is much more widespread in our community before you make that decision to get your child vaccinated. You want to make sure they're vaccinated beforehand. We don't obviously have any good or clear data if children are more at risk with this new variant, but Delta is still with us. It's 99% of the cases. And even with Delta, you're still seeing a high number of children getting infected and unfortunately ending up in the hospital, experiencing even MSC. So really, really important that we do get our children vaccinated because it is now a preventable disease.
And on the other side, if I'm not mistaken, the vaccination has proven to be enormously safe for young people. We've got now several million doses delivered to the 5 to 11 age group in the United States alone. And I believe the signs are incredibly encouraging about the safety for that age group. Can you say anything about that?
Absolutely. And as you've mentioned, we've had millions of children that have gotten their first doses, as well as those that have gotten their second doses, and we have not seen any significant safety signals. So I know that there was initial consideration of, would we see more cases of myocarditis or pericarditis, as we've seen in the adolescent population, even though it's a rare rare condition, and those that actually get COVID itself are at higher risk of actually experiencing that condition. But we have not seen any of those cases. We haven't seen any significant safety signals from the current real world rollout, as well as in the clinical trials. And you're also seeing that children in this age group certainly actually have a lesser extent of experiencing any type of symptom. So usually after any type of vaccination, whether it's your flu or your COVID, sometimes you feel a little run down afterwards, which is completely normal. You're seeing children in that age group have even a lower threshold of experiencing those types of side effects.
So I know we lose you in about 2 minutes. We want to respect your busy schedule. This has been an amazing conversation. Maybe you could just close out with a thought about the long term. We know that COVID won't entirely disappear from this earth, just like the 1918 flu is still with us. But we can manage it to the point where it's not an ongoing crisis, where it doesn't disrupt our life and have such a horrible impact. When do you think that's going to happen? When are we going to be able to start lifting some of these restrictions? Or is it dangerous even to predict that kind of future?
It's an excellent question, and a question that all of us get all the time. And I think it really speaks to the larger picture of the global picture. It's not over until it's over all around the world, because the US doesn't live in a bubble. And we've seen that with the Omicron variant. With now that we have better vaccination rates, now we're seeing these newer variants pop up. It's because we're not vaccinating enough. And so I think that there's 2 parts to it. First, we want to make sure that we should get the pandemic control around the world for all of our safety. It's not just for a humanitarian purpose. It's really also to be selfish. We want to protect our vaccine-induced immunity. So it's in our best interest to ensure that we're looking at it from a global perspective. And then second, we are going to see this virus become endemic in the sense that we're going to live with it as we are now, but less in a sense where it's urgent, it's an emergency, and so many people, like 1,000 people are getting infected every day, over 1,000 people dying. It's not going to be that case. And the way for us to get to that point is if we have much more immunity in our population, and preferably through vaccine induced. And so that's really where our end game is going to play out. So it's going to happen. It's just hard to predict when that will occur.
Well, we feel better knowing that you're going to be out there fighting for us every single day. And I am so grateful for you spending an hour of your time. This has been an incredibly informative conversation. We could have spent another hour or 2 and not gotten to all the questions. And my goodness, those of you who joined us from the community, thank you so much for this incredibly vibrant conversation in the chat. and so many good questions. We got to many, but we know we couldn't get to all of them. Thank you again, Dr. Madad. Thanks to all of you who joined us. We will be back and do these as long as it takes. We're going to keep getting that information out there. And particularly, I saw a few of you asking for an update once we know more about Omicron, and we'll do that. We'll come back. I'll give you the final word, Dr. Madad, before we have to close out.
No, I just want to say thank you so much for the opportunity. It's a pleasure to speak with you. It's a pleasure to speak with everybody that has tuned in today. I hope that you've learned a couple of things. And feel free to ask any additional questions you may have. I'm happy to answer them afterwards, but thank you and stay safe. And we have the tools to protect you and your family. So we want to make sure that we're using them.
Wonderful. Thank you again for that message. And thanks to everyone for joining us tonight. Again, I'm Councilman Mark Levine here with Dr. Syra Madad, and we'll see you again soon. Be safe, everybody.